Hi, I'm Dr. Nicole Vane of Moonlight Beach Dental, and if you're watching this video series on lasers, stay tuned because there's some pretty phenomenal stuff that's around the horizon with what I'm going to be doing with my laser. Now, I talked about how I can use a laser for gum surgery, and I can use a laser for removing decay, I can use a laser for frenectomies, but those are all cutting procedures. We actually have an attachment for this laser that's a wand. And this wand can do two procedures, actually three procedures. One is called soft laze. And I'll be using the laser to do lip plumping, painless lip plumping. We literally use the laser to pulse and draw collagen in, and it'll stimulate collagen formation. So after a couple sessions, stay tuned, I will be the first live patient that you'll see, and you can see how much better I look, hopefully, in the next couple of months. But you come in, it takes less than 10 minutes, you don't need to be numb, and we pulse the lip all the way along certain points, and that'll end up causing the collagen to form. You come back, and we'll stimulate more collagen formation, and you'll get a gradual lip plumping that's really aesthetic and can never look unnatural because it's from you. We can also use this laser to treat the nasolabial folds. Again, who wants some? Me! So I'm going to be doing the nasolabial fold revision, which we use the laser on the inside of the mouth, again, not cutting, to plump these lines from the inside out so you don't get these frown lines or laugh lines that are pretty deep. So that's called the soft laze procedure. We can also use it for all sorts of wrinkle and scar revisions, but I'm not a dermatologist, so I'll probably just be sticking to the aesthetic procedures that involve the mouth area. Now, the other portion I can use this for is called night laze. So if you're a snorer or someone with sleep apnea, we'll actually be able to use this wand to shrink back, again by stimulating collagen formation, the areas of your throat that when you're recumbent at night, if you think about the little dangly piece, the uvula in the back of your throat, there's tissue folds that are back there, the fosses of the back of the mouth, that when we wand this back there, and it's just like shining a flashlight, there's no pain, over time, actually pretty rapidly, over about 24 to 48 hours, it'll shrink that tissue back and you'll actually be able to breathe a lot better. So there's a lot of studies out, I'll try and put some on my site, that show through the American Medical Association as well as in sleep dentistry centers how much this is helping patients improve their airway, which is the true cause of sleep apnea. And the final thing I can use this amazing tip for is something called BioStim. So if you listen to some of the other videos in this series about the laser, BioStim is actually, again, stimulating collagen formation, but if I use a certain pulse mode of the laser, the photon energy at a distance as I converge on tissue can actually cause pain to go away and the inflammatory cycle to shut off or reverse. So if I'm doing a surgery where I'm thinking someone's going to be swollen or really sore or uncomfortable, or I could do something simple like an injection that causes a lot of jaw soreness or something called trismus, where the muscle spasms. I can come in and pulse along the jawline, or pulse in the area where I did the extraction on the outside of the mouth, or pulse someone who's already swollen, and the BioStim feature actually causes the reversal of the swelling. I actually had it used on me. I had gum surgery. I am a thin, petite female. I was also sedated, so I was worked on for about 3 hours, never had dental work really. I woke up the next morning and I had to work an 8-hour day and I was swollen out to here. Literally looked like I had an egg in my cheek. It was really embarrassing. So called my friend the surgeon and she biostimmed me. And the swelling, the cellulitis that would have taken about 5 to 7 days to go away on its own naturally, it was gone by the end of the day. She biostimmed me and it literally just reversed. So I think that that's amazing for someone who has chronic or acute pain or chronic or acute swelling. We can use it for all of these side features in helping patients be more comfortable. I mean, you can use it actually on torn ACLs, rotator cuffs. You can use it on all sorts of things. But again, I'm going to stick to anything from the chin up. Come see me. Come see if the BioStim is something that'll work for you in preventing pain or in reversing chronic injury. Thank you for listening, and I hope to see you at the office soon.